Hi, katzcradul here. About 13 months ago, I had several skin cancers removed. It was done as an outpatient. I was an outpatient at a surgery center, and I posted that video in November of last year. In fact, it was on Thanksgiving the day after I'd had the surgery. So many of you have asked for an update, and I have just kept putting it off because it's not particularly a video that I wanted to make, but I keep getting requests, so I'm just going to do it. I will warn you, there are some graphic photographs in this video. If you saw the video I made the day before Thanksgiving in 2011 talking about this surgery and it didn't bother you, then this is not going to bother you as well. There are some photographs that show some very fresh stitches and some bandage, so I just wanted you to have a warning before I show those. I am including a few photographs in here that I did not include in the video I made last year. There are some photographs that I took for my surgeon and sent ahead to him so that he could see them before I actually had an appointment with him. He lives about his office is about an hour away, so it helped for him to get these ahead of time. So you can see there's 5 spots there, one close to my eyebrow, one on the bridge of my nose, one on the tip of my nose, and then 2 under my nose. The one that concerned me most, of course, is the biggest one that was on the tip of my nose. It started out as a small spot that was kind of like the one up there by my eyebrow, but it got bigger and formed 3 lobes, and one of those little lobes became very purple, and you could see veins in it, and it was forming its own vascular system. And because of the rapid growth, I decided we better go ahead and take care of this. My surgeon agreed, and we set an appointment for me to meet him one morning at a surgery center, and we took them all off. Now I realize that this looks incredibly painful, but my surgeon is very skilled, and I have a very high threshold of pain. So while this was uncomfortable and annoying, I was not in a lot of pain. You can see where the 2 little yellow bandages are. That's where he actually did a skin graft. And so he has stitched those little bandages in place so that if anybody were to hit me or anything, it wouldn't irritate that graft. He wanted to be sure that they absolutely were held in place, and so that's what that's all about. The surgery took probably about an hour and a half, and I was in recovery for about 30 minutes, and then I went home. So here's the place where they removed the 2 below my lip. There was a lateral incision and a horizontal incision and then a vertical incision, and you can see that this healed up very well. The horizontal incision, the one directly under my nostril, is actually hidden in the shadow there under that nostril, and then the one that is vertical is actually hidden in the little line that you have 2 little lines under your nose, and one of them is actually under that line. So nothing shows there under my nose. Now here's a close-up of the 2 that were up on the bridge of my nose, and here's how it looked when I came home from surgery. The lower one had to have a skin graft on it, and then here's how it looks today. You can see the graft there, but if you're just a few feet away from me, you can't even notice it all, and the upper scar you can't see at all. Okay, here's another close-up of the 2 skin grafts. That's both of them, and then you can see both of them in this photograph today. Now I don't wear any base makeup or anything like that, so this isn't covered up. I have a little eye makeup on, but nothing on my nose, and they look really good. And when I have my glasses on, you can't even see the graft that's up there. Almost the pad of my glasses sits on that. The worst scar I had was this incision that is in front of my right ear, and it ran from the bottom of my ear up into my hairline. That's where they took the graft from. And my doctor promises me that it will, over time, just kind of blend in with the wrinkles that we typically get there right in front of our ears. It's really hardly noticeable even today. I have a matching scar like that on the other side of my head from another surgery, another skin graft that had to be taken for a skin cancer that was in my ear. So I just consider it just a little mini facelift. They just pulled a little skin back there. Anyway, that's just to update you for those of you who were curious, and I hope you found it interesting, if nothing else. Skin cancer is nothing to mess around with, and I really encourage you that if you see any suspicious spots that you get them checked out. Until next time, this is Cat's Cradle.